Come on in.
Hi, nice to meet you.
Hi.
I'm Liz Jewelski, representative of GlaxoSmithKline. May I have a seat?
Yes, take a seat, please.
All right, Dr. Smarty Pants. Here is my business card for you in case you ever need to contact me for anything. Any questions, concerns, anything at all, just give me a call.
Sounds good.
Thank you so much for meeting with me. You know, I'm a little nervous. Please excuse my nervousness. I'm new at this. Don't want you to be too harsh, but I'm sure I can handle any question or concern that you have.
Perfect, not a problem. We like seeing new faces coming in and out, and if you're good, then we'll see you again. So feel free to take your time and talk away.
Thank you. Okay, so to start with, would you say you have a lot of patients coming in with migraine complaints?
I would say 25% of our customers are using 2 different products for the migraine issues. So yeah, about 25%.
What 2 migraine medicines are those that you're prescribing?
Maxalt and your Imitrex.
Okay, all right, I'm familiar with those. And have these medications been completely successful, or have there been complaints?
Well, in most cases they've been pretty well, but we still get a handful of people that aren't affected by the medications.
Okay. Well, with that being said, do you think your patients would be interested in learning about a new migraine medication?
I believe so, and having another option is ideal, and that's what we're looking for at this moment.
Okay, so as you know, I'm representing GlaxoSmithKline, which has just come out with Truximet, which is a new migraine medication.
Okay.
Have you heard about it yet? Have you studied it up?
I do know a little bit about it,
Okay.
the ingredients and some of the side effects.
Okay.
Would you like to elaborate maybe on
I
that?
would. Right here I have a printed list of all the serious side effects and other side effects that come along with Truximet. And as you can see, they're pretty basic and standard for all the different migraine medications that are out on the market.
Okay.
Pretty similar.
Yeah, they are mostly similar, so nothing out of the ordinary here. A question to you would be, if somebody's already on Maxalt, is there any issues if they were to start taking this pill?
No, actually that is a very good question. As long as a person is healthy enough to be taking this type of medication, they should be perfectly fine. And say from transitioning to Maxalt to Truximet, from Maxalt, all the patient would really need to do is if they've taken Maxalt, they just have to wait a full 24-hour period before they take their first dose of Truximet.
Okay, and that's pretty common with pills, 24 hours, it runs through your system. That's great. Next, would you maybe give me a little bit more detail on how it works?
Yeah. Okay, so for starters, this is a picture of Truximet itself. Okay. It is a blue pill, obviously. It's going to be a little bit smaller, a little bit too big for any of us to swallow.
That looks pretty massive to take, yeah.
Yeah, but it's basic, blue pill, Truximet. And here with me, I have a list of what Truximet contains. It contains the sumatriptan and the naproxen sodium. And those 2 ingredients combined to make Truximet, and it shows you their effectiveness. It shows you sumatriptan alone is 55%, and then naproxen sodium is 44%. Combined with Truximet, together patients are seeing like a 65% migraine relief within 2 hours.
Within 2 hours?
Yes.
That's exactly what a lot of these medications we are looking for. That being said, would you say Imitrex, your old product, worse than this new product you have coming out?
They're both good products, and they work in separate ways. Truximet has the active ingredient of Imitrex, which is the sumatriptan, and it also has naproxen sodium. So just like Imitrex, it's going to narrow the blood vessels around the brain, and because of the naproxen, it works by reducing the hormones that cause inflammation and pain inside the body. So you're getting dual relief, which gets you faster migraine relief.
Okay.
Here's another chart I wanted to show you, which shows it out. This line right here with the diamonds is Truximet. Compared to sumatriptan alone, it gives you higher percentages of patients with relief.
All right. Well, that's great to hear, and having this visual concept will help me understand a little bit more about it. That being said, can you give me some insight? Is the pill easy to take? I know we talked about that a little bit. Any concerns before taking it? You have to eat something. Can you maybe elaborate a little bit more on that?
I sure can. The pill is very easy to take. You can just swallow it. It goes down pretty easy for most of the patients that have tried it. The pill can be taken at any time. Like the food in the stomach, it does not affect the absorption rate of Treximet.
Okay.
So you can take it on an empty stomach, on a full stomach. You can take it whenever you get that first sign of the migraine pain to make sure you combat it and get rid of it as fast as you can.
Okay.
Yes. And then one other thing I wanted to point out was that I brought these with you today to show you what everyone's saying about how effective the pill is. These are non-biased reviews, actually. These are not printed from the GlaxoSmithKline website. They are from a different website.
Okay, so a lot of these customers pretty much looking for what you have to offer. Side effects, similar. Pricing. You want to elaborate a little bit on that?
Okay, so as you know, these type of medications, they are pretty pricey.
Okay.
And Treximet is no different. The average price for Treximet is about $2.35 for a bottle, which contains about 9 pills.
Okay.
And so that comes out to be about $26.11 for each individual pill. But those prices, of course, would get reduced greatly by your patients that do have insurance.
Okay, well, that being said, the price is a little bit high, but I understand the need for that, what it takes to develop those type of pills. I do like this product, and if I could maybe understand a little bit more, what is it want to call benefits to this product. Can you give me a little bit more input on that?
The best benefit of this product, I would have to say, is the the rate of which the patients are getting the migraine relief.
Okay.
Because they're getting it faster and it's staying longer than, say, Imitrex.
Okay.
As you can see by, sorry if you don't mind.
No, go ahead.
Imitrex, they're getting it a faster relief. They're getting the relief sooner than with just the Imitrex alone, the sumatriptan, the active ingredient. So they're getting their faster relief.
All right. Well, that sounds great. Do you have anything to conclude?
No, that is it. So you like the product so far? You like everything you're hearing?
I do like the product, and having another product like this in our facility and more options is what we're looking for right now. So you kind of caught us at a good time.
That sounds great. So would you be able to, say, prescribe this to your next 5 patients that come in with a migraine pain?
5 patients. How about 10 to 15?
That would be perfect.
10 to 15 will give us a better understanding the results and how it works. More people use it, the more reviews we get.
Well, thank you.
Not
it's
a problem.
very nice meeting with you. If you have any questions or concerns, you have my card. You call me, email me, and I will get back to you as soon as I can.
All right.
Thank
you for coming out.